Hello, this is Dr. Kim Jong-il. Today is a lecture on the factors that affect the occlusal plane. Let's briefly review the contents of the previous lectures. In conventional orthodontics, overruption and underruption of the maxillary and mandibular teeth were important factors in the orthodontic treatment. Whereas in MEAW orthodontics, it is argued that the upper occlusal plane and the posterior occlusal plane affect not only the vertical height but also the anterior teeth. This is because, for example, it changes depending on the situation, such as mesial inclination of the mandibular posterior teeth and overruption of the mandibular incisors. Then, let's see how this occlusal plane is formed. As you may know, at the age of 3, the primary dentition is completed. And at the age of 12, the upper and lower second molars erupt and permanent dentition is completed. In doing so, what is called the occlusal plane is formed. However, there are several factors that affect the occlusal plane during the process. Buccinator mechanism, upper and lower first molar, second molar. Vertical height of anterior teeth, difference in direction of eruption and degree of eruption. Habit, tooth loss, ankylosed tooth. Disharmony of arch width, anteroposterior disharmony. Cross bite, etc. The occlusal plane can be changed by various factors. A functional occlusal plane is used for the deciduous teeth, which is the line connecting the cusp tip of the mandibular primary second molar to the incisal tip of the primary mandibular incisor. This deciduous dentition does not have an anteroposterior or lateral curve, so you see a flat occlusal plane. The first molar of the upper and lower jaw erupts around the age of 6 years. At this time, the maxillary first molar shows a distal inclination, and the mandibular first molar shows a slightly mesial inclination. As the permanent dentition erupts, a curve of Spee is formed. In other words, the mandibular first molar is slightly higher than the mandibular primary second molar, and the permanent incisors of the mandible erupt slightly higher than the inheritance of the mandible, forming a curve. At the age of 12, a second molar erupts. At this time, the maxillary second molar is directed distal, and the mandibular second molar is inclined toward the mesial side. As the mandibular second molar erupts higher than the mandibular first molar, the curve becomes more severe. We call this curve the curve of Spee. This curve of Spee shows a single arc with a radius of 4 inches. It is said that some people go through the condylar axis or the front of the condyle. This curve shows the change in the anteroposterior inclination of the mandibular teeth. In general, the mandibular incisors erupt at a right angle along the hinge axis of the mandibular condyle. The posterior teeth likewise try to be inclined more mesially to erupt at a right angle. Therefore, a natural curve of Spee is formed. Next, as the time comes for the teeth to exchange, the posterior teeth are more and more inclined forward. Therefore, sometimes there is insufficient space for the maxillary canine and the mandibular second premolar to erupt. It can be said that the change in axial inclinations of the tooth is a kind of compensation at this time. Therefore, in the process of developing permanent dentition, the mesial inclination of the teeth must be carefully observed. There is a term called DPO. It is the distance from the hinge axis to the occlusion plane. What does it mean to have a long DPO? This means that the posterior vertical dimension is sufficient. Conversely, short DPO means lack of posterior vertical dimension. When a baby is born, it is edentulous. At this time, there is no curve of SPE. This occlusal plane is almost parallel to the inclination of the condyle. As the dentition erupts, the condyle and occlusal plane are formed. At this point, the DPO will gradually increase. As the DPO increases, so does the deep curve of SPE. Brachyfacial types with round faces have a relatively long DPO with enough posterior teeth. However, dolichofacial types with long faces have a relatively short DPO as a high-angle type. If the DPO is long and short, the radius of the curve of SPE is also different. Let's compare this as a carnivore versus a herbivore. Since herbivorous animals such as cattle and sheep grind a lot, the DPO is long and the posterior vertical dimension is sufficient. However, DPO is short in carnivore. The longer this DPO is, the more severe the curve of SPE is and the smaller the radius. The shorter the DPO, the longer the radius for the curve of SPE. So there are very few curve of SPE. Therefore, it can be seen that curve of SPE is severe in deep bite, low angle type, whereas curve of SPE is rarely observed in open bite. In summary, in the case of high CF, which is a low angle deep bite, the DPO increases, the radius of the curve of SPE becomes shorter, and the possibility of the deep curve of SPE increases. In the case of low CF, which is a high-angle open bite, the DPO distance is short, and the radius of curve of SPE is long. So the curve of SPE is almost flat. Let's compare the deep bite and the open bite patients again. Until now, deep bite patients have said that the DPO distance is sufficient, and open bite patients have a short DPO distance. The occlusal plane used at this time is the gnathologic occlusal plane, which is the line connecting the distabecal cusp of the mandible first molar from the mandibular incisal, for example. Next, let's look at what factors affect the posterior occlusal plane. These are the anterior component of force, the patient's growth direction, posterior discrepancy, and early loss of the primary molar. The first is the anterior component of force. The anterior component of force is the theory that the tooth moves in a mesially inclined position during its lifetime. Factors affecting this include tooth shape, mesial inclination, occlusal muscular forces, and transeptal fibers. The second is the direction of the eruption of the teeth. According to Bjork's, in high-angle type cases, the posterior inclination of the mandible is slightly uprighted rather than the mesial inclined. On the other hand, in the deep bite, which is a low-angle type, it was said that the mandibular posterior teeth were severely inclined. However, in the low-angle type, the mandibular posterior teeth are mesially inclined. But the skull is flexed so that the POP value is flat or normal. On the other hand, in the high-angle type, the mandibular posterior teeth are uprighted. But because the mandibular plane angle is steep and the skull is extended, the POP increases. Therefore, in both cases, it means that the mandibular posterior teeth are mesial inclined. Here is the posterior discrepancy. This means the maxillary first, second, third molars disharmony. The posterior discrepancy measures the distance from the mesial surface of the fifth molar to the ramus anterior border or PNS. What can happen if this space is deficient? Professor Sato said that if posterior discrepancy is insufficient, over-eruption and the mesial angulation of the molar may become more severe when the third molar tries to erupt. Next is the early loss of the primary molar. As the permanent teeth erupt, the primary molars lose their own teeth. What if they are lost early? The mandibular first molar is more mesial inclined. In such a lack of space, the posterior molars will erupt and fall more and more mesial inclined. At this time, most of the mesial inclination of the mandibular first molars are more pathologic than physiologic problems. This is mainly because it is affected by posterior discrepancy. What will happen if there is posterior discrepancy? Looking at the lateral second-order bends, the posterior teeth become overruption or mesial angulation is observed. From the occlusal point of view, mesial rotation of the posterior teeth is observed. When viewed from the front, the mandibular molars are lingually inclined, and the maxillary molars are highly likely to be cis or bite. The mesial angulation of the mandibular posterior teeth is very important. If the mesial angulation of the mandibular molars is severe, the possibility of class 3 malocclusion increases. This is because the mandibular posterior teeth are located more anteriorly than the maxilla. Or it may look like a class 1. This is because the mandibular molars are mesially inclined, but the maxillary molars are also tilted forward to compensate. In some malocclusions, the mandibular posterior teeth are mesially inclined, but a class 2 malocclusion is shown. Why does it happen? This means that the entire mandible is located posteriorly. At this time, the POP is flat in class 3, and the POP is steep in class 2. Let's review it again. In low angle, the posterior teeth are more mesially inclined. And in high angle, posterior teeth are uprighted. However, at high angles, the mandibular plane rotates backwards and downwards. It can be said that the mandibular posterior teeth were mesially inclined. This can be interpreted in the sense of anterior component of force. Thank you for watching.